Let's go to 6 months now. What kinds of things are you looking for at that point? That's also when they begin to introduce solid foods. So what kinds of things do you discuss with parents at the 6-month visit?
Sure. We certainly talk about, sort of readiness for food and things like that. A good idea to kind of prepare for readiness for food is a baby that's starting to sit up independently, that they can manipulate their own, truncal stability to make sure that they have an appropriate position as they're eating. We also look for a good grasp. Babies should be starting to hold things, bring 2 hands together and put an object in their mouth. And then solid foods, really babies can start at 4 months actually. So we recommend starting, just a basic cereal. Often we start with rice because it's considered the least allergenic at 4 months. And then we progress until we're adding other solid foods generally around 6 months. And that's things like pureed traditional baby foods that either moms make or they can buy at the grocery store. We recommend spoon feeding those, oftentimes just once a day to start. And then as babies are getting better, then we go up to 2 times a day. Generally, we don't go to 3 feedings a day until babies are about 9 months old. And then generally speaking, we really recommend that moms start food slowly. Pick one, do that for 2 or 3 days in a row, and then sort of progress and add to their repertoire from there. Meaning start with, peas. Do that for 3 or 4 days. Then you can start doing green beans. Do that for 3 or 4 more days. You're doing green beans and peas. Now you're doing yams on top of that, or sweet potatoes. So either of those, kind of slow progression concepts for adding new foods to a baby's diet is really appropriate for their age.
And one of the reasons for that is also to watch for signs of allergy, right? It's easier to figure out if they're reacting to something if they haven't had 5 new foods in the last day.
Exactly. I think that's a really thoughtful way to add food to a baby's diet by going slow and making sure we don't have food allergy cropping up.
So you were talking about how sitting up is an important thing that you look at and consider when deciding if a baby's ready for solid food. At what point should a baby be sitting up, and when should a parent talk with the pediatrician if their baby isn't sitting up?
Good question. So generally we set about 6 months as the average age for most infants to be sitting. Sometimes that depends on infant to infant, depending on some variability. And you have to take into account we choose a milestone sort of marker for all babies. You have to remember that about 50% of kids have already hit that milestone by that, median or average age, and 50% aren't quite there yet. Does that make sense?
Yeah.
So just make sure if you're concerned and you're noticing your baby isn't sitting by 6 months, that you bring that up with your primary care provider at a visit. Your primary care provider should be screening for those things with you at your well visits, but certainly they can do a better job addressing your concerns if you're able to express those concerns kind of during the visit.
Yeah, a pediatrician and a parent are a perfect team, because the parent spends all the time with the child and knows like what's normal for them, what's not normal, and then they can bring up all of those things with the doctor, and from a professional standpoint kind of screen what's concerning, what's not. So
Certainly.
Yeah, in between appointments it's important for parents to like write down everything that they have questions about and come with those, because being a parent myself, I know I've gone to appointments and I leave thinking, oh, I forgot to ask about this, and then you have to wait another 3 months or whatever.
Sure.
So yeah, good advice to write everything down.